Welcome to Removable Partial Dental Design module. This module consists of two parts. First part is about components of RPD such as connector, retainers, and etc. I will also explain about Kennedy classifications. On the second part, we're going to take you through some example in designing RPD. The Kennedy method of classifications was originally proposed by Dr. Edward Kennedy in 1925. It attempts to classify the partially edentulous arch in a manner that suggests certain principles of design for a given situation. As a clinician, knowing or understanding Kennedy classifications will help you to communicate better and clearly with your other clinicians and technicians. Under Kennedy classification, there are four major groups of partially edentulous arch which are commonly used in dental school all over the world. Class 1 is when you have bilateral edentulous area located posterior to the remaining natural teeth. Class 2 is when you have a unilateral edentulous area located posterior to the remaining natural teeth. Class 3 is when you have a unilateral edentulous area with natural teeth located both anterior and posterior to it. And Class 4 is when you have a single but bilateral, by means is that it is supposed to cross the midline, edentulous area located anterior to the remaining natural teeth. Now, Kennedy classification would be difficult to apply in every situation without certain rules for applications. Applicate provided 8 rules that govern application of the Kennedy methods. If you can see from this slide, I have summarized the 8 rules into 5 bullet points. The first one is that the classification should include only natural teeth involved in the definitive dentures and should follow rather than precede extraction. That means the classification should be identified after extractions. If the third and second molar are missing and not to be replaced, they are not considered in the classifications. However, if they are present and used as a department, they should be considered in the classifications. Now, the mean classification is determined by the most posterior area. That means when you look at the model, you should look at the edentulous area towards the posterior first. Edentulous area other than those determining the classification are called modifications, and the number of modification spaces is considered, not their extent. Modification spaces can be included in Class 1, Class 2, Class 3, but Class 4 should not have any modification. So RPD can be constructed using these 4 major components, which are the connectors, retainers, clasps, and tooth replacement or denture bases. Connectors can be further divided into major and minors, and retainers to direct and indirect retainers. Okay, let's look after the definition of major connectors. Major connector is the part of a partially removable dental prosthesis that join the component on one side of the arch to those on the opposite side. So we're going to see that from the diagram here that major connector can be further divided into mandibular and maxillar major connectors, and first we're going to talk about maxilla. So if you can see from the list here are the few examples of maxilla major connector. They are posterior palatal bar, anterior posterior palatal bar, palatal straps, anterior posterior palatal straps, U-shaped connector, and complete palate. Now, the anterior posterior palatal bar and the palatal bar mentioned in many textbooks are just variation of the anterior posterior palatal straps and the palatal strap major connectors. Now, they should be bulky in order to be rigid, and thus they are generally acceptable for many patients and not recommended. Now, palatal straps are indicated in Kennedy Class 3 partially edentulous arches, but bear in mind that the strap dimension should be of minimum 8 mm, and is also contraindicated if large palatal torus is present. Some of the advantages of palatal straps include rigidity, great resistance to bending, and also contribute to indirect retention. These advantages include discomfort from palatal coverage and also adverse soft tissue reactions such as papillary hyperplasia. Anterior posterior palatal straps are usually indicated for Class 1 and Class 2 arches with excellent abutment and residual ridge support, or sometimes when you have inoperable palatal tori that do not extend posteriorly to the junction of the hard and soft palates. The anterior and lateral strap should be at least 6 to 8 mm wide. The posterior palatal strap can be at least 4 mm wide to increase patient comfort. The palatal opening should be at least 15 mm or more in anterior-posterior dimensions. Some of the advantages of anterior posterior palatal strap include rigidity, great resistance to bending, great support, and more exposed palate. However, this type of major connector may interfere with phonetic. U-shaped connectors are only used in those situations in which inoperable tori extend to the posterior limit of the hard palate or when you have a prominent median palatine suture. The advantages of U-shaped major connector is an open palate which provides more comfort, offers vertical support and short connectors. The drawbacks are flexibility and tendency to spread laterally, lack of cross-arch stabilities, and it can sometimes interfere with phonetics. Now, complete palate should only be used when you need extra support from the soft tissues. These apply when you have only some or all anterior teeth remained, when you have class 2 arch with large posterior modification space, when you have class 1 arch with 1 to 4 premolar, however your abutment support is poor and your direct retention is quite difficult to obtain, and this can also be used in the absence of a pendiculated torus. Now let's move on to the mandibular major connectors. Here are just some of the examples of the major connectors. There are lingual bar, lingual plate, double lingual or Kennedy bar, and the last one is labial bar. Now, lingual bar are the most common major connector to be used when you have sufficient vertical space between the floor of the mouth to the gingival margins. So what are the measurements? You need height of 4 mm and a thickness of 2 mm of a half pear shapes in cross sections of the lingual bar, and if you look cross-sectionally, the thin edge should be facing towards the teeth. Other than that, you should also need another 3 mm below the gingival margin. Therefore, you require at least 7 mm of vertical space between the floor of the mouth to the gingival margin. This type of bar should not be used when you have large inoperable tori. Some of the advantages include the design is quite simple, it has minimal contact with soft tissue, and it does not contact teeth. However, the disadvantages include the measurement of the minimum depth of the vestibule. Lingual plate should be used when adequate width for a rigid lingual bar does not exist. It can also be used when you have resolved residual ridge in class 1 arch that offer a minimal resistance to horizontal rotations. This type of connector can also be used in periodontally weakened teeth. So how do you construct lingual plate? So the metal plate should cover the cingulum of the anterior teeth and the superior border must be scalloped. Some of the advantages of lingual plate that it's very rigid, it provides most support, and sometimes it can also be used as indirect retentions. These advantages include extensive coverage of teeth and soft tissue, which will end up with poor oral hygiene. Another drawbacks include the display of metal in cases where you have a large interproximal spaces on the anterior teeth. Double lingual bar is usually indicated when axial alignment of anterior teeth required excessive block-up of intraproximal undercuts, or when large diastema exists and a lingual plate would display metal in a frontal view. Advantages of this type of connectors include no gingival margin coverage and also horizontal stabilizations. The drawbacks of this connector includes foot entrapments and phonetic problem. Labial bar are usually indicated when you have lingual inclinations of anterior teeth or when you have a broad lingual tissue undercuts that prevent placement of conventional lingual bar or lingual plate. This type of connector can also be used when you have severe lingual tori that cannot be removed. Advantages of this type of connector is that it can be used when you have unfavorable tooth control of soft tissue control. However, this type of connector will lead to distortion of a lower lip. Some patients complain of discomfort, and it's also subjected to depth of buccal vestibule and frenal attachment. RES is components of removed partial denture that serve primarily to transfer forces occurring against the processes down the long axis of the abutment teeth. The primary purpose of the RES is to provide vertical support for the partial denture. In doing so, it also does the following. It maintains components in their plane positions. It maintains established occlusal relationship by preventing settling of the denture. It prevents impingement of soft tissue and directs and distributes occlusal load to abutment teeth. Now, RES can be classified into three different groups. We have occlusal RES, cingulum RES, and incisor RES. Occlusal RES should be round, triangular shaped from the occlusal view. Its base should be at the marginal ridge and its apex should extend towards the center of the tooth. The floor of the rest should be spoon-shaped from the sagittal view. The deepest part of an occlusal rest should be located near the center of the mesial or distal fossa. The size of the rest should be 1 to 1.5 mm with tapering center of the tooth measuring 0.5 mm. So lingual rests are utilized on anterior teeth, primarily on the canines. A satisfactory rest seat preparation can be made with minimal tooth reduction due to its well-developed cingulum. So preparation should be V-shaped when viewed in cross-section and crescent-shaped when viewed in occlusal view aspect. The correct angulation of the floor of the rest seat should be less than 90 degrees from the proximal view. If you do a preparation of maxillary canine, the average dimension should be 2.5 to 3 mm mesial-distally, 2 mm labial-lingually, and 1.5 occlusal-gingivally. Incisor rest preparation should be V-shaped, placed on the mesial or distal incisor angle, and its deepest portion should be towards the center of the tooth. Incisor rest seat size should be approximately 2.5 mm mesial-distally and 1.5 occlusal-gingivally. Incisor rest seat preparation should be V-shaped, placed on the mesial or distal incisor angle. The deepest portion should be towards the center of the tooth. Incisor rest seat size should be approximately 2.5 mm mesial-distally and 1.5 occlusal-gingivally. The apex of the V should be rounded. Let's move on to the next component of RPD, which is the retainers. If you remember from the previous diagram, retainers can be divided into two, which are direct and indirect retainers. Direct retainers can be further divided into two, which are intracoronal or extracoronal. For the sake of this module and level of undergraduate teachings, I'm going to focus more on the extracoronal direct retainers. Extracoronal direct retainers can be divided into two, attachment and retentive class assembly. Retentive assembly include two groups, which are occlusally approaching and gingivally approaching class. Before we go any further discussing the different types of occlusally and gingivally approaching class, let's look into some basic components of a class. A class should consist of 5 major components, which are rest, body, reciprocal arm, retentive arm, and minor connector. So what do all these terms mean? Rest is basically the rigid extensions of an RPD that contact the occlusal surface, incisal edge, or cingulum of a tooth or restoration. Body is the rigid part of the class assembly, joins the rest of and the shoulder of a class to the minor connector. Reciprocal arm is an element capable of resisting pressure exerted by the retentive arm during insertions and removal of RPD. Retentive arm is a portion of a class assembly that lies apically to the height of the contour of the abutment tooth when the RPD is fully seated. Minor connectors is the rigid component that joins the body of the class assembly to the remainder of the framework. Now, apart from components of a class, there are also another 6 requirements of a class design. It's important for you to take note of all these requirements in order for you to construct a fully functional class. The requirements are retention, support, stability, reciprocations, encirclement, and passivity. So what do these terms mean? So retention, if you look up on the definition, is the capability of an RPD to resist vertical dislodging forces during function and probably the most important responsibility of a class design. Support is the ability of the RPD to resist vertical seating forces. Stability is the resistance of an RPD to horizontal forces and maintained by reciprocal element and minor connector. Reciprocation means quality of a class assembly that counteracts lateral displacement of an abutment where the retentive class terminus passes over the height of contour. Encirclement is a specific features of class assembly that prevent horizontal movement of the abutment. Now the class assembly must engage the tooth of more than 180 with a direct contact. Now passivity is the assembly of the class where it should be passive and should not exert any force to the abutment tooth. Now, these are just some of the examples of occlusally approaching class that are commonly used. The first image on the top left side is actually a simple circlet, a simple and widely used class and a class of choice for tooth-supported RPD, where mesial buccal undercut is present. On the upper right side is what they call reverse circlet. It is usually used when you have undercut present near the edentulous space. On the bottom right hand side is embrasure class, which most frequently used in candidate class 2 or class 3 RPD when no modification is present to service for additional class design on the opposite side of the main edentulous areas. The last image on the bottom left side is a ring class, which usually used in tilted molars, and it's encircle nearly all of an abutment tooth. These images are just some examples of the gingivally approaching class. The first image on the upper left side is a T-class. It is the most commonly used gingivally approaching class, and you can see the T-shape which nicely engages the undercut near the cervical portion of the tooth. The second image on the upper right hand side is a modified T-class. This class type is more appropriate to use in abutment teeth with aesthetic considerations such as canines and premolar, since one of the projection is absent. On the bottom right side is a Y-class, which is just an alteration of the T-class. It encircles the abutment better than T-class, but display more aesthetic concerns. The last image on the bottom left side is an I-bar class. It is a class without any mesial and distal projections, commonly used in RPI system in distal extension RPD. Now let's talk a little bit about RPI class design. In distal extension-based RPD, the most accepted stress-releasing design described is the RPI systems. RPI class design is a current concept of bar class system which consists of three main components with specific features. These components are mesio-occlusal rest, proximal plate, and I-bar class. The RPI design meets the need for vertical support, horizontal stabilization, retention, reciprocation, and passivity. However, RPI class design is contraindicated in certain cases, such as when you have insufficient depth of vestibule, because remember you need at least 3 mm distance for the vestibule depth in order for the class arm to approach the tooth. It's also contraindicated in tilting of the abutment tooth if you have buccal tissue undercut, whereby the severe buccal tissue undercut will cause the class arm to approach the tooth too far away from the gingiva. Others include if you have spine display where patients with great gingival tissue display, this also contraindicated, or if you have to use lingual plate as a major connector. Now the alternative to RPI class design is just basically using RPA class design. So RPA class was developed to overcome the contraindications and limitations with RPI design. In this design, the mesial rest and the proximal plate features are identical to those of RPI. The only difference is the use of an anchor class instead of the I-bar class. Okay, now let's move into the next component, which is the minor connector. Minor connector is actually the connecting link between the major connector or base of a partial removal dental prosthesis to other units of the prosthesis, such as class assembly, indirect retainers, occlusal rest, or cingulum rest. If you look after the diagrams here, you'll be able to see some of the example of minor connector, such as those that actually join the class to major connector, those joining indirect retainers or auxiliary rest to major connector, those joining a denture base to major connector, lattice and meshwork constructions, and also bits wire or nail head minor connector. Now let's look after some general aspects of minor connectors. Minor connectors should provide rigidity and unification by joining other components of a framework to a major connector. Thus, the transmission of forces among the major connector, abutment teeth and oral tissue can be achieved. Minor connector should also act as a bracing component and maintain the path of insertions when they are located on guiding planes. Minor connector should also be rigid and placed so as not to irritate the surrounding tissues. If you look at the images on the upper right side, you can see that there is an example of indirect retainers that is connected to major retainers. The second image showing you a class that is connected to the major connector, and the last one is just basically nail head minor connector. The last component that I would like to talk about is indirect retainers. So indirect retainers is actually a component that assists the direct retainers in preventing displacement of the distal extension, denture base, when the denture base moves away from the tissue in pure rotation around the fulcrum line. And if you can see from these diagrams here, you'll be able to see that the fulcrum line has been drawn, and you'll be able to appreciate the necessities to have indirect retainers to prevent the rotation around the fulcrum line. Indirect retainers can be presented in many forms, such as auxiliary occlusal rest, canine extension, single lumbar or Rugae support. The denture base should provide few functions such as support the artificial teeth to receive forces from occlusions and transfer functional forces to supporting oral structures. It may also add to the cosmetic effect of the replacement, particularly when techniques for tinting and reproducing natural-looking contours are used. Another function of the denture base is stimulation of the underlying tissue of the residual ridge. It is clearly evident that oral tissue placed under functional stress within their physiologic tolerance maintain their form and tone better than similar tissues suffering from disuse. Denture bases differ in functional purpose and may differ in terms of the material of which they are made. Two supported partial denture bases that replace anterior teeth must function such as giving desirable aesthetic, support and retain the artificial teeth, prevent vertical and horizontal migration of remaining natural teeth, eliminate undesirable foot traps, and stimulate the underlying tissues. In distal extension partial denture bases must contribute to the support of the denture. Maximum support from the residual ridge may be obtained by using broad, accurate denture bases, which spread the occlusal load equitably over the entire area available for such support. When constructing any denture bases, whether of resin or metal, and regardless of the method of fabrication, it should come as close to these ideal criteria as possible. Denture bases should have accurate adaptation to tissues, it shouldn't irritate tissue surface, has good thermal conductivity and low specific gravity, has sufficient strength, can be kept clean easily, good aesthetic acceptability, the ability to reline, and low initial cost.